Army healthcare personnel must be prepared to give emergency life-saving treatment at any time, any place, under any conditions. This program deals with one such emergency life-saving task, inserting an oropharyngeal airway. This task is performed on an unconscious casualty only. For training or practice purposes, use a mannequin capable of accepting an oropharyngeal airway. Do not practice this task on a conscious person. You have taken infection control precautions and positioned the casualty on his back. Normally, you will use the head tilt chin lift method to open a casualty's airway. However, if the casualty has a known or suspected spinal injury, then use the jaw thrust method. Your initial assessment of the injured soldier shows that he is unconscious, not breathing, and has a steady heartbeat. To maintain an open airway, you will need to insert an oropharyngeal airway, also known as a J-tube. J-tubes come in various sizes. Select the correct size airway by measuring from the corner of the casualty's mouth to the tip of the earlobe on the same side of the face. It is critical to select an airway that is the correct size. An airway that is too small may be ineffective. One that is too large may block the casualty's airway even further, or may even cause harm to the casualty. Now that you have selected the correct size airway, you are ready to insert it. First, open the mouth. Cross the thumb and forefinger of one hand and place them on the casualty's upper and lower teeth at one corner of the mouth. Spread your fingers apart using a scissors motion to open the casualty's mouth and hold it open. Position the airway so that it is pointing toward the roof of the casualty's mouth. Since the task must only be performed on an unconscious casualty, we will be using a mannequin to demonstrate the actual insertion of the airway. Insert the airway and slide it along the roof of the casualty's mouth past the uvula, or until you meet resistance against the soft palate. Be careful not to push the casualty's tongue back into the throat. Watch the progress of the airway closely. Do not perform this task by feel alone. Gently rotate the airway 180 degrees and complete the insertion. The tip of the airway should be pointing down into the casualty's throat. Make sure the flange of the airway is against the casualty's lips. If the airway is the wrong size, remove it and insert another one. Now that you have inserted the airway, you are ready to perform ventilations on the casualty if necessary, using the pocket mask, or the bag valve mask, also known as a BVM. If the casualty starts breathing on his own, continue to monitor him very closely. The airway may be left in a casualty who is breathing on his own only if he does not exhibit a gag reflex. If the casualty exhibits a gag reflex or starts to regain consciousness, remove the airway at once. Let's review the steps of inserting an oropharyngeal airway. First, use the head tilt chin lift method to open the casualty's airway, or use the jaw thrust method if a spinal injury is suspected. Then select the correct size airway. Next, open the casualty's mouth and hold it open. Correctly position the airway. Insert the airway and slide it along the roof of the mouth until you meet resistance against the soft palate. Then rotate the airway 180 degrees and complete the insertion. Check to see that the flange of the airway is against the patient's lips. Remember to closely monitor the casualty for vomiting, gag reflex, or return to consciousness. Remove the airway at once if any of these occur. Thanks to your quick action, this soldier's condition has been stabilized sufficiently so that he can be examined further.